Hi, I'm Dr. Stanford Owen. I'm developer of this PrescriptFit medical nutrition therapy program, and I am board certified in internal medicine. I'm also board certified in nutrition and in psychopharmacology. And I've used nutrition therapy as part of my practice to treat patients for 25 to 30 years. My program is a nutrition therapy program and not so much a weight loss program. Although patients will lose plenty of weight, that's not the intended goal or the measured outcome. Nutrition therapy means we use it to treat diseases related to nutrition or obesity, like diabetes, hypertension, back and joint problems, acid reflux, sleep apnea, a whole host of issues. What I've found through the years is that patients really don't care that much about their weight. Weight is usually implied to mean the way that you look or how you're being judged by other people. And it really is not a tremendous motivator long term. On the other hand, if you feel bad and you're functioning badly, um, most patients usually do care how they feel and function, and therefore we focus on the medical outcome in this particular program. The program is I developed some outcomes about a decade ago, measuring the response to specific medical conditions. I have in a workbook called the PrescriptFit Calendar Workbook, not only the methods and mechanisms to follow your nutrition therapy progress, but also to follow the diseases and symptoms that you are encountering. And I have 13 different medical conditions which we follow on a 0 to 10 scale very easily, or with your particular um, measurement, like a blood sugar. So that if your blood sugar goes from, say, 300 to 110, or if your pain in your joints goes from a 10 to a level 2 or 3, or your breathlessness goes from a 10 and now you can breathe easily with no breathlessness or shortness of breath, you can measure that. So this allows you to see how quickly and how completely and at what rate your condition responds to nutrition therapy. That's what motivates patients long term. And when they splurge or have a life crisis or an event that distracts them from their nutrition program and they relapse, they know they go back to the program and should respond in the same number of days or weeks that they responded the first time. If you're on a diet program to lose weight, you lose 50 pounds, it may take you months, maybe even a year, and you gain that weight back because you got distracted or had a life crisis. Are you going back to that diet program? Probably not. You're going to try every other diet program that's out there, maybe make full circle and come back to the program eventually. With nutrition therapy, the responses are in days or weeks, so you go back to that program as soon as you splurge or fall off the wagon, your condition comes back and symptoms come back under control and you're feeling good again. That motivates you to stay with the program long term. And it's fairly simple. Clinical outcomes are non-judgmental. When you're on a diet program, people say, oh, you don't have any willpower, you're weak, you cheat, all these negative connotations. This is simply a measure of discomfort or a measure of sugar. There's no judgment to it whatsoever. That's important in the long term as well, because we hate to be failures. And if you're measuring weight, you cannot not be a failure. The final paradigm about nutrition therapy, as I see it, is patients go back to what works. Again, if a diet plan doesn't work, you're not going back to it. If the symptoms get better, you're going back to it. And finally, the program has a whole host of mechanisms built into the behavioral program to reinforce your staying with the program, the most simple of which is to keep accounting in the calendar workbook. All you have to do is record in about 20 seconds a day as you're only accounting. But if you do, you'll be 80% more successful for those 20 seconds than the people who don't account for it. And then there's the physiological or the chemical reasons that patients will get well in this program. And that includes improving insulin resistance and decreasing inflammation by changing your metabolism. In my book, The Amino Solution, I go through, in the front part of the book, the science behind the program and how it was developed. In the middle part of the book, I go through the 12 food groups that we have. There's no portion control, and then no food groups that are off the table. Splurging is a normal behavior on this diet plan. So you'll see that it's very mainstream nutrition. There's nothing unusual about the program at all. Any dietitian, any physician should see this straightforward. And finally, the back section of the book goes to the medical illnesses that we expect to respond. Every case being different, you measure your own results in your calendar workbook along with your physician. And we have programs set up in clinics all over the southern United States and all over the United States with very good results in all kind of different medical specialties. And our clinics are very happy with the way their patients are responding, just as they do here and just as I've seen through the years. So you can have your physician contact me directly, or you can contact me directly at drdiet.com. And specifically my email address is drowenmd@diet.com. That's Dr. Owen, MD, at drdiet.com. Keep us posted of your progress. We're certainly anxious to see how you do. And if you have any problems, don't hesitate to email us or contact us. The phone number is on our materials and our site as well. So call that number and we'll do the best we can to help you. So good luck and read the material. Use the materials that are presented to you. If you're unsure what to do, get the materials and read them first. If it sounds logical, it sounds simple, and it sounds doable for you and your family and your children and even at work and your whole life, then you'll be successful with it. Good luck. Thanks.